Welcome back to BRMC's Healthy Connections with Dr. Adam Newman, plastic surgeon, and his lovely wife Christy, who, as I mentioned before, is also his office manager. That's got to be a lot of fun working together.
You would think so, but we don't see very much of each other during the day because we're both running so much.
Sure. So, well, we've had talked with our folks here that have joined us before about the 3D tomosynthesis or mammography that BRMC has put in at the hospital, and you're part of that team. So how does what you do as a plastic surgeon fall in with the team approach that they're using as far as breast reconstruction?
Well, it's very exciting, that we'd even have this opportunity to have the latest technology here in a small town like Mountain Home.
Yep.
And you throw in the fact that we have a full array of the physicians we need to then implement the best strategies for our patients. And that means that you have a primary doctor, whether it's your family practitioner, maybe a gynecologist, maybe an internist, and they are your family doctor and help you get your mammogram set up. So they get that set up through the hospital, and then you can get your mammogram done. And the exciting thing about this, I don't probably have to tell too much about how it works, but is it's almost like a CT of your breast instead of an X-ray. So compare the two, you can see how much difference there is from a regular X-ray of maybe your lungs, and you can see how much better it is if you take a CT scan of it. And I do facial trauma, same thing. If you see an X-ray, sometimes it's really blurry, and you can see things that are there, and there are certain characteristics you can look for. But if you take a CT of it, you see the 3D part of it, which is what this does, is it becomes 3D. It's infinitely better how much you can see. And so not only can then the radiologist look at it and say, oh, here's something suspicious. We find it early. That's great.
Right.
But they can also say, well, here's this lesion. Let's take another look at it. And so before they go, okay, well, let's have her come back and we'll take a look. Now we can actually have them done right then. Well, that looks suspicious, so let's look at the 3D part of it. And the 3D goes, okay, that's nothing bad. So we don't have to call as many people back to do things that are unnecessary as well, which then translates to comfort onto the patient.
Sure. Because I just talked with someone today that I ran into, and we were talking about the 3D tomosynthesis, and she said, were you ever called back? And I said, oh yeah. And there's nothing worse than that waiting period to, is it something or isn't it something, when it's done the old film way, as I say. And there's nothing worse. You don't think you're stressing about it till you get the all clear that everything's okay, and then you kind of go,
and you find out.
Oh, okay.
And Christy can tell you up front, she, when she was 18, she had a biopsy for that very exact reason, and that waiting period from each time. You don't get a mammography until you're, usually 40, or if there's a concern, maybe you get one before that. But at 18, she had this issue, and go ahead.
Yeah, well, you just, at that point you don't know, and you have this waiting game. You go for, the needle biopsy, then you go for the next one. Like with mine, I didn't know what I was going to wake up with. They said if it's something if we get in there and it's worse, then we might have to take your whole breast. I was lucky, and it ended up being not near that, and mine ended up being benign. They just removed the tumor, and that's where it ended. But that made a very lasting impression, and that was when we were first dating.
Oh my goodness!
And I think that has had an effect on decisions we've made. And his grandmother actually had breast cancer.
She's 85 years old this month, and she's survived since 42 years old when she was first diagnosed, and bilateral mastectomies.
Wow!
So people ask, oh well, what genre or age of women? I mean,
the
18,
whole spectrum.
The whole spectrum.
Sure.
The whole life of a woman.
Right.
So I think that's definitely it, to remove that emotional stress for when it's not necessary, and then to go, okay, there is something here, and
can we catch it early?
Move fast enough, catch it early.
So how does plastic surgery fit into that? Get back to your question, because like I said, I get really detail oriented quickly. So
and that's all good. We love that.
Next, your family doctor, the oncologist, the radiologist will help decide, and give you some information about which doctors can help. Obviously, if they find something, they need to find out what it is and get it out. That's key. And then, in spite of that, that's usually what's called a breast surgeon, which is a general surgeon that then does breast surgery. All of our general surgeons in town, which we have 5 of them, are well versed in that part of general surgery, so they're excellent to be able to do that. At that same time, it's always important to see a plastic surgeon as well, because you don't know what they're going to do. And like Christy said, when you go to sleep, you're not sure what's going to happen. You need to know what your options might be beforehand. And traditionally, especially if a plastic surgeon wasn't around, and 3 years ago I wasn't around and this wasn't an option, they would do the mastectomy, the lumpectomy, and then whatever treatment was necessary, and then they'd see a plastic surgeon down the road to restructure their
Which
life.
means another coming back, another surgery
Right,
at
and now
another
that
time.
a
And
plastic surgeon's available, that's reconfigured that. And traditionally, if that would happen, then somebody would have to leave town where they had a plastic surgeon. Well, that's not necessary anymore.
and that's wonderful. We're
Yeah.
so glad you're here, both
So
of you.
that does help for sure.
Yeah.
That being said, not everybody needs plastic surgery. Not every person would benefit from it, and there's special instances where you know you might need radiation beforehand, where it's better to not do plastic surgery, but you still need to go through and know your options beforehand, because literally you don't want to burn bridges. And this is one of those situations where if certain procedures are done, then you lose an option that you might have had before. And then that's why you need to see the oncologist. That's the cancer doctor. At the initial time before you undergo the surgery, you need to see the radiation oncologist, which is not just a cancer doctor, but a cancer doctor that specializes in the radiation and delivery of radiation therapy, of which we have both here.
Right. And we are so blessed in this area.
So
we've got
all,
we've
and
all
yes,
of it.
those are pretty specific specialties, as is plastic surgery. To be in a small town, it's pretty uncharacteristic.
And the reason I'm really glad that you're talking about the breast reconstruction, because I think sometimes there's a misconception with plastic surgery that it's all cosmetic, that it's all, I want all these wrinkles gone, I want, whatever it might be, my eyes lifted, my facelift, a nose, do something, change it, make Mother Nature go away, stop her in her tracks.
The funny thing is, this usually comes up, what is plastic surgery? Is it going to make it look like I'm plastic? No, that's not it at all.
No.
In fact, plastic is a Greek word to make or mold, and that's why you make or mold plastics, or in this case, make or mold to increase what we call form and function of the body. And so that is cosmetic as well as reconstruction. But the ultimate goal for both is to make somebody feel better about how they look and feel and their function as well.
Right. And boy, do you do a great job at both.
Well, it's all important. It's very artistic, so that's very much part of what I do. But there's, I did 7 years of residency, continue to upgrade my maintenance of certification. I'm board certified in plastic surgery by the American Board of Plastic Surgery.
And all of that's real important. I always want our viewers to understand this. Whenever we've talked with our anesthesiologists or anyone, that this board certification, this is really, really important. This is, you've spent a whole lot of your life going to school.
I sure have. And then I took the test to prove that I know how to do it as well. And I still can't promise everything is perfect. And, when you think of something like breast reconstruction, there are a lot of steps. It's not like, well, we can just do the surgery and it'll be perfect. There's some steps that if you use a different kind of reconstruction, there's different forms of reconstruction. One would be immediate in the time of the original surgery. Another one would be delayed. One would be using implants or expanders. Another one would be using a person's own tissue. And there's various ways of using this to make it ideal for the person that is having the procedure done. So it's really important to know up front what your options are, and then to
make those decisions.
Help make that decision.
Yeah, absolutely, because I think those decisions, like you say, 3 years ago weren't available here.
Right.
People had to go someplace else or just sort of drop it. I'm going to go in, have the surgery done by the general surgeon, and at that point it sort of stops until down the road.
Right.
So.
And I've when I first got to town, I'd say the majority of my patients I saw were ladies who are like, well, I'm not sure if I really want to do this, and then later they've come to me and said, well, I've decided to go ahead, and they just feel so much better about themselves. And Christy can tell you that one. That's so rewarding. It's not an easy road to find out you have breast cancer and then go undergo the treatments and therapy and all the the sickness and all that, and then to get through it and then still feel bad about yourself.
Yeah,
and
for certain. I think a lot of the women too that come, they are in that survival mode. And whether they decide to do reconstruction or not, the thing that I have really enjoyed, and the rest of the women in the office do, is kind of helping them walk through that process of, even if you're educated, you can be empowered, and rather than just operate on survival mode, the more information you have, the better choices that you can make
Right.
along the way. And that's very
alleviate the
empowering for
fears.
women
Sure.
to not feel that they're just adrift in the sea of the medical community being passed from physician to physician, but that it's truly a core team that is looking out for their interests and allowing them to participate in some of those decisions, that gives them a little bit of that sense of control back that they lost that moment they heard the word cancer potential.
Exactly.
So,
and sort of deer in the headlights. All thinking stops. All
Right.
It's just, oh my gosh, I've got the big C.
Right.
What do we do now? So thank goodness you guys are there. Now, where are you located?
We're at 200 North College Street.
Okay.
So it's right here in Mountain Home.
Right here.
And
Just close
really
to
close
Walgreens.
to Walgreens. Yeah, right at 62 and Walgreens
Okay.
on College Street.
Right. We need to take a short break. We'll be right back. Don't go away. We've got lots more that we want to share with you. We'll be right back.